Hi, I'm Suzanne Smith, licensed clinical social worker and owner of Align Counseling of Colorado, and I'm passionate about attachment. Today I'd like to talk to you a little bit about attachment. The following tips are a compilation of both my experience through the years of work with adoptive families, as well as the research, writings, and practices of the following experts in the field of adoption: Karen Purvis, Daniel Siegel, Brian Post, Daniel Hughes, and Bruce Perry. You probably went into the adoption with the best of intentions and a lot of love to give. Perhaps you were thinking that maybe I can give my child a better life than what he or she had previously had. Maybe when you met your kiddo, it didn't go as you had hoped or planned. Maybe your kiddo didn't bond to you the way you had hoped. Or maybe he or she did bond to you and you had some trouble some weeks or months down the road. Whatever the case may be for you, I hope that you will find at least one of the following tips to be helpful. The first and most important tip, in my opinion, is self-care. Self-care is vital to our well-being and to the well-being of our child. I know that we all lead very busy lives, and self-care is often in the backs of our minds, or maybe not in our minds at all. However, I cannot emphasize how important self-care is when raising biological foster or adopted children. Recall the presentation the flight attendant does at the beginning of a flight. The attendant reminds the adults on the flight to secure their oxygen mask before they secure the oxygen masks of their children. The same principle applies to parenting. If our oxygen is depleted, we simply cannot parent effectively. Consider enjoying a cup of coffee or tea with a supportive family member, taking a walk in the park with a dog, or catching a movie with a good friend. Whichever way you decide to take care of yourself, please be intentional and consistent about it. Another crucial part of securing the oxygen mask is to make sure that you regularly tend to the relationship you maintain with your partner or spouse. Parenting adopted children sometimes comes with challenges that constrain intimate relationships. It is especially important if difficulties with your adopted child arise that you can turn to your significant other for guidance and support. Maintaining a secure attachment in your intimate partnership also has another benefit. Observing a strong bond between their parents is often very reassuring to an adopted child with whom you are forming or deepening a bond. I like to call this the trickle-down effect of attachment. So even if you are incredibly busy, please be intentional about taking care of yourself, however that may look and in whatever way that may be, both as an individual and in your intimate relationships if you have a partner or spouse. Make sure self-care is an intentional and consistent part of your schedule. Please securely fasten your oxygen mask. The second tip is called attunement, and attunement is achieved when parents tune in or pay very close attention to the emotional state of their child, which, as we know as parents, can change at any given moment. Have you ever met someone who really understands you and what makes you tick? What qualities does this person have? Do they listen to you without interjecting an opinion and show a sincere interest in what you have to say? Do they provide you unconditional support, validation, and compassion? If you have ever experienced this, allow yourself to reflect back for a moment about how wonderful truly being understood by someone else feels. This is called attunement. Attunement happens when someone tunes in to the emotions of another person and responds back with empathy. Attunement in adoption is particularly important, as parents may discover that their child's history has a real influence on him or her. Some adopted children come from backgrounds of abuse, neglect, or trauma. Others may have come from a foster home or orphanage where they were well taken care of and securely attached to their caregiver, and may now be experiencing intense feelings of grief or loss, even if they were adopted by you at a young age. Whatever your child's history, he or she will benefit from attunement. Paying attention and tuning into your child will help you to become more aware of what your child's possible triggers, hotspots, and sensitivities are, so you can better pinpoint what your child needs from you emotionally. This may require some experimentation, But as you practice tuning in, you will learn more about your child's emotional playing field, and from there, you can provide the kind of support your child needs. There may be a little guesswork involved in becoming an attuned parent, but what will result is a greater understanding about what makes your child tick and a deeper sense of security and feeling of safety in your child. The third tip is called felt safety, just as the name implies, and that is our ability as parents to make our children feel as safe emotionally, mentally, and physically as possible. Take a moment to think about what makes you feel safe. What comes to your mind? Feeling safe is a basic human need and is vital in maintaining a secure attachment with your adopted child. The first thing to keep in mind is that even though you may know you are maintaining a safe environment, your child may not yet know that. Your idea of felt safety may be different than your child's idea of felt safety, particularly if he or she comes from a background of suspected trauma, abuse, or neglect. How can you help to establish a feeling of safety? Think about entering his or her world for a little while. Take a deep breath, open the observation deck, and place an investigative hat on your head. What events do you notice that upset him? What factors do you notice that soothe her? Based upon this, what do you think you could try to create a feeling of safety in your child? One way might be to make his or her world a little smaller and slower paced. Perhaps you abandon the idea of a large family get-together or cancel a few playdates to spend some time alone as a family in your home for now. Consider creating a predictable routine. Cook a favorite meal together or play a favorite game together. Maybe read a favorite book together. Perhaps you're reading the same book for the 157th time together, but that very book is what your child has come to know and expect, and reading it together will likely increase the feeling of safety. These are just a few of many ideas. As your child's level of felt safety increases in your home, he or she will also likely feel safer in the outside world. At this point, it is okay to gently encourage venturing out into new experiences together, and eventually new experiences on his or her own, with your reassurance that you will be close by and present if needed. The fourth tip is about the delicate balance of nurture and structure and how each are vitally important to raising our children. Balancing nurture and structure can be difficult for many parents. Some parents think that one is more important than the other and may favor one in their parenting style. However, it is important to recognize that both components are important in parenting. What does nurture mean to you? Does it mean telling your child how much you love her? Does it mean showering him in affection? Does it mean that you protect and shelter? Nurture can mean many different things, and it is important that your child feels loved and cared for by you. You cannot spoil a child with too much love, and nurturing is the very glue that cements a bond between parent and child. However, nurture alone is not enough. Your child also has to know that you are the one who ultimately makes decisions in the home as the adult caregiver. Parents who gently assert that they are in charge are setting the appropriate structure for their children. Establishing limits and boundaries in the home for children increases their felt safety. It shows them that they are cared for and that there is a responsible adult in charge who is looking after them. Please keep in mind that when setting limits in your home, it is important to do so in a calm manner. Remember to hold the boundary assertively and consistently, yet gently. Remember to get in the line of sight of your child and make sure he or she has heard you and is clear about the limit you have set forth. Try to refrain from voicing commands in an angry tone. As balancing nurture and structure can be one of the more challenging concepts to implement, please be patient with yourself. You may make small mistakes from time to time. Securing and maintaining attachment with your adopted child is sometimes based upon your willingness to try new things to determine what will get the most positive response. As long as you are making good faith decisions in the interest of his or her well-being, you are on the right track. We're often told, act your age, We often tell our kids, act your age. In this section, we find out that age is so much more than chronological. Have you ever experienced a time when your adopted child acted younger than his or her biological age? Biological or chronological age is defined by how many years old a person is, as measured from their date of birth. Emotional age, however, is often a very different concept, particularly in children who were adopted older than the age of 1. That is why it is important to keep in mind that under stress, your child might regress to an emotional age younger than his or her chronological age. There are a few reasons why this happens. One reason might be that your child did not have adequate treatment or attention in the placement in which he or she resided before coming to you. As babies, young children, and human beings of all ages are wired for attachment, mistreatment or a lack of interaction can interfere with brain development. This may mean that your child might have some catching up to do. Another reason you might observe a younger emotional age might be that as your adopted child is getting adjusted and used to your home, he or she might regress to a younger age in an attempt to feel secure. Whatever the reason, often in times of stress, you may observe behavior in your child that appears immature. Please try to refrain from telling him or her to act their age, even when patience runs low. When stressed, your child will benefit from you treating him or her at their emotional age. So if he or she is chronologically 7, but acting emotionally like a 4-year-old, and you suspect stress is the culprit, take a deep breath and treat your adopted child as if he or she is 4. Sometimes adopted children need us to take a step back in time and meet them where they are at. The more that you do this, the more likely you will be able to reduce your child's stress, and he or she will sync back up with their chronological age. Just as this tree depends upon its roots for nutrition, structure, and support, our child depends upon us for the same. Attachment takes place over the course of a lifetime, not just in the first year, as researchers had previously thought. New research in the area of brain development shows exciting promise that even older children can heal from past loss and trauma. This means it's never too late to make a difference in the life of a child. There's always help and there's always hope. If you're struggling with your adopted child, please call now.